Hello, this is Instructor Flores with ReadyForNclex.com. Now, if you find yourself watching this video, you're probably interested in things that can help you prepare and review for your Nclex exam. Now, before I get into any details about what I have to offer and what's included in my website that will help nursing students prepare in passing the Nclex, I need to ask you a few questions that are very important. First question is, what do you think will most commonly show up on the Nclex exam? There has to be some sort of algorithm or some sort of common topics that students must be tested on in order to be determined as competent registered professional nurses. So, is there anything that can give me a sense of what will most commonly show up on the boards? Next question is, do I have to study everything in nursing in preparation for the Nclex? If I don't know what the question is asking me when tested, do I still have another chance of getting that question correct? Out of all the lab values to memorize out there in the nursing curriculum, which ones should I memorize the most? I mean, there's just so many with electrolytes and blood cell counts and all these chemistries that we have to remember, cardiac enzymes, renal functions, liver functions. There seems to be a lot to memorize as far as values. Are there ones that will be tested more so than others? Also, medications. There are tons of medications. The PDR is about 1,000 pages thick, and nurses have to know so many medications, but as a student nurse, how many medications should I know? Is there a certain amount? And as far as the names for the medications, there's like 2 or 3 names for all the medications. So how should I prepare in knowing my medications? There's just too many. Is there a review class that is just straight to the point, easy to understand, and doesn't throw hours and hours and hours of material at you that usually don't even wind up showing up on the Nclex? How do the Nclex review classes know what to review in reference to what can possibly show up? How do they know what to focus on? Are there effective strategies that can help me with those most difficult questions? Last, there seems like there's so many review classes out there to choose from, and they all appear to be at least $500 or more. Some of the review classes are included in my nursing curriculum. Should I bother even looking at other review classes to supplement my preparation? And is there at least a review class that's less than $200 and won't break the bank? The answers to all the questions that were just asked is yes. And for more information, you can go visit www.readyfornclex.com and find out what I have to offer you in preparation to succeed in the career that you worked so hard for in overcoming this last hurdle, this last final chapter, this last step for the rest of your life. In the website, I go into more details as to how my review differs from all the others and how my review will help you in a simple way without any difficulty. There are just some things that you do have to do as far as studying for the Nclex, but the rest is all up to me providing you with information and you receiving it. www.readyfornclex.com